We'll go. And are you guys okay? Yeah?
Great.
We're going live.
We are going live now.
Perfect. So I can't see the bottom of the screen, so I don't know how many people are coming in and out. Maybe Dee, can you tell me, can you see on the bottom of your screen how many people are coming in? Are there people coming in?
Now it's 30, I guess.
Okay, so maybe we're just going to give it a minute and let everybody arrive. Shall I time it a minute? Oops, now we lost the screen. There we go. Okay. So if anybody is online, I mean, everyone in the room can hear me, I'm pretty sure. But if there's anybody online just to say welcome, we're just going to give it one more minute while we wait for more people to come in. I can't see how many. Perhaps I think we're already at 34. So I'm actually going to say welcome. Welcome to the room in Birmingham where we have 190 people. And I would say 90% of them are people with lived experience of hepatitis C. Oops, I've forgotten to say something first. We have to do the interpreter. So for those of you who would like interpretation, please look at the bottom of your screen and you will see there's like a little globe. And if you click on that globe, there, exactly there in the picture, then you can choose your language of choice which should be either Spanish or French. If people are messaging in the box, I'm really sorry, I can't see it because I'm actually facing the wrong way, which is a little bit disconcerting because I'm a control freak and I can't control this. But I'm going to start again and say, I want to say welcome to everybody for joining our World Hepatitis Day Community Forum. Welcome to Dee, who is joining us from China, Prince, who's joining us from Nigeria, and would you both like to introduce yourselves, actually? Dee, do you want to introduce yourself?
Hi, this is Dee from China. Actually, I'm the elected board member for the West Pacific region for the World Hepatitis Alliance. I got hepatitis B at the age of 2. Yeah, I'll talk about it a little bit more later. Yeah. Just wanted to jump into too much in the very beginning. So after you, Prince.
Yes, thank you very much. It's my pleasure to be part of this community forum. My name is Prince Okinado, and I'm from Nigeria, Delta State precisely, and I'm one living with hepatitis B, and I'm the founder and the team lead of Hepatitis Advocacy Foundation, a foundation I set up in 2020 to respond to my personal diagnosis 3 years after I was diagnosed, and to also reach out to people who are living with viral hepatitis, and also to call on the government. We're a pressure group trying to advocate for better care for people who are living with viral hepatitis. Thank you very much, and it's my pleasure to be here.
Thank you both very much for being here. And just to go back to where I started before, you are sat with 190 people, 80% of them have lived experience of hepatitis C, and we're have spent the morning in a patient peer conference, celebrating the role of lived experience in the elimination of viral hepatitis. So welcome to everybody. Before we begin, we've actually got a video which hopefully will just kind of evoke the feeling of it's time for action for this World Hepatitis Day. Can you play the video, Ben, please?
Hepatitis is now the world's deadliest virus after COVID-19. It claims 1.3 million lives each year, and the number of deaths is rising. There is no time to waste.
It's time for action.
Leaders, it's time for action.
Politicians, it's time for action.
Doctors, it's time for action.
Communities, It's time for action.
This World Hepatitis Day, 28th of July, we must all take action.
Test.
Treat,
Vaccinate.
visit worldhepatitisday.org.
Brilliant, thank you. And I mean, I don't know about you guys, but actually, I mean, I really like that video. I think I particularly like the music because it's got that fast beat, which is like gets my heart going, and it's about action, isn't it? So just before we begin, I just wanted to give a little overview of, you saw some stats there. Just to give that global overview for this, that the World Hepatitis or the World Health Organization estimates that 254 million people lived with hepatitis B and 50 million with hepatitis C in 2022. However, only a small fraction knew, because just 13% of people with hepatitis B and 36% of people with hepatitis C were actually diagnosed. Meanwhile, there are over 6,000 new cases of viral hepatitis every single day. And the reasons for this situation remain the same as when they were, as literally as when I was diagnosed in hepatitis C in 1998, irrespective of the arrival of DAAs, which is a cure for hepatitis C, a vaccine for hepatitis B, and a raft of tools that we have to disseminated by the World Health Organization. Resources are not being mobilized, stigma and discrimination are not being addressed, and despite commitments by nearly every single government in the world, millions of people being left behind. And that's why this is, it's time for action is our slogan, our message for this year. If we don't kind of address and get our feet moving with action globally, we've got a window of about 2 years to do this, to get the whole action moving globally. If we don't, then there are many countries that are not going to reach elimination. Currently, there are, I think, maybe 11 countries in the world that are on track to eliminate, and I'm fortunate enough to be, sat in a room in a country where that is going to be possible, but that is very few countries across the world. So we really need to encourage our governments, and I think Prince said something there in his introduction, to encourage our governments to ensure that people have access to tests, to treatment, and information and raising awareness. So we have an hour session here. We have 3 incredible speakers who are going to share a bit of their experience. We have Dee from China, who's already introduced herself. We do actually have a speaker from the room, Rachel, who will come and join us in a minute as well, and her experience of hepatitis C. So rather than me waffle on, because that's what I tend to do, I'm going to actually hand over to Dee. If you could just maybe share a little bit of your lived experience and maybe tell us about how your lived experience has shaped the actions to eliminate hepatitis. Because I think the big message for today from us in the room is that we are more than our voice, that we are action too, and without the input and the action of civil society or, people with lived experience, we are not going to reach elimination. So Dee, over to you.
Thank you, Rachel. So even though I've been talking about my story as a person living with hepatitis for the last decade already, more than a decade, 12 years, but still I'm every time when I have to put these words out of my mouth, I'm still thrilled and privileged, and at the same time still very scared, and I really have to talk about my story. So start from the very beginning. My mom is a Hep B free person when she had me, a couple of decades ago. All right. So my dad is Hep B free person as well. And when I just at the age of 2, I have to go to the doctor. I have to go to the hospital to do the blood transmission. This is the only one thing I can really say about myself getting contacted by the hepatitis B is when the time I have a large amount of blood, someone else's blood into my body. So it's basically an iatrogenic, infection. But back then, from the age of 2 to So I had a treatment at the age of 2 to the age of 3. And lucky enough, my condition, my ALT level is relatively low. Everything seems to be fine until the day at the age of, I still remember it's 10, after the some sort of body examination process sessions. I myself happened to be, called upon by the, by the dean and my teacher to say, hey, I really need you to come over because there's something I need to talk to you about your body condition. At the time, there are 50 class, my classmates in the same class. So 10 of us, which is 20% of, the whole class, got nicked out of the the very normal class session and called upon to say, hey, young boys, young girls, you are aware that you're a hepatitis B, carriers. I need you to do the body, examination, on monthly basis, or sometimes like, 6-month basis. So that's why the first time I know that I'm a hepatitis B carrier. And some of my, classmates and among those 10 people had to go to the hospital to do the treatment. And some of them to drop out of school. And but I'm still lucky enough. My teachers are good enough. They were very, very protective to me to say, D, I will keep your privacy until the day, you have to, get one day your happy-free day. So not until that, when the time when I have to go for get a job, at the age of 20, let's say 24, I got a job in a very big, manufacturing group in Guangdong province. So at the time, I was told that I have to do the body, one of the hepatitis B kind of like status check. So of course I'm positive. So according to the paper, that I'm not allowed to work in the factory because I'm hepatitis B carrier. I tried so many other stupid means. For one thing, I drank up for like a liter of Chinese. It's called baijiu, but actually it's Chinese vodka, because I was told back then, if you get the alcohol inside my body, the virus level would drop significantly. Of course, it's totally a lie. And then I pay for possibly back then is £200, which is a lot of money to someone who's going to find a job in the factory. So I paid £200 to buy a special, kind of like drugs to say, take this drug, you'll get yourself, your happy negative within like 2 days. Of course, it failed in the end. But I got a job in the end in the factory. Guess what? I asked my friend who looked alike, me, to replace me to do the blood kind of like extraction. So I got it. I got the job. But I was still very scared to say, what if I just got found out? So I have to work hard to to do something for my company. My job is a HR related work, and so I have to protect my some sort of company who gave me a very good salary. But at the same time, I myself, there's one particular job I have to do is to do all this I'm going to scrutinize all the hepatitis B carriers inside the factory to put them in a specific Hep B table during the dinner and lunch, telling people, say, move away from these people, or else you will just, get the hepatitis B very easily. So that's the narrative back into like 2000 and let me think, 2007. It's very nasty. It's very, I'm gonna say, a toxic air for the person living with hepatitis B. But guess what? Back then, 10% of the population are hepatitis B carriers, are the people living with hepatitis. We people living in fears on daily basis. So for me, every night when I go to bed, when I went to bed, I have to think of myself like, so I am helping my I'm just helping my company to really to reducing or maybe to increase the stigma and discrimination against the people like me living with hepatitis. I couldn't sleep. I couldn't, jack up anymore to say, right, I have to work hard for the next day to do a better job. I just totally lost my appetite for my work. So I decided to say, to talk to my, company, say, you're wrong. You're doing such a wrong thing to the people living with hepatitis B, because according to the medical, facts, this is basically science. You are not going to get the hepatitis B by sharing utensil, hugging, even kissing. So I quit the job, started my organization to help with the people living with hepatitis on discrimination and stigma. We had a hotline, getting people the consultation, and also when we got the some sort of a complaint about getting discriminated in the workplace, we will help this person to file a lawsuit or maybe to negotiate with their employer to say what you did, what you've been doing for the people living with hepatitis is wrong. You need to get a change. So I've been doing this for 10 or 12 years already. So I feel proud, I feel energized, and I will still keep doing so until the day the hepatitis B is, totally, free as a bird for everybody. Sorry, I couldn't hear the claps, but I know you guys been, saying high praise to my story. Thank you so much.
Thank you, Dee. Thank you. I'm just thinking, so we can either, Rachel, do you want to come up? Oh, she's here. I just think so we can split it. So we have a male, female, and also 2 hepatitis Bs. So I'm going to introduce you to Rachel. Come and sit down. And something that everybody doesn't know, and I'm going to really embarrass her now, is it's her birthday today. So Rachel's going to share her experience and just kind of a little bit of her lived experience and how that has helped with elimination, or how that you are using that in your everyday life in terms of working with supporting us to eliminate hepatitis.
I just want to get, hi, I'm Rachel. I just want to get off my chest first. I'm so nervous. Like, I was only asked to do this last night. I don't really want I'm going to say. So I'm just recently a new volunteer with the Hep C Trust. So, yeah, although I suppose I'm still a bit ashamed to say, I was one of them who was reinfected with hepatitis C. I remember the first time I caught it, didn't know nothing about it. I'd only shared a needle once, and when I was asked to do the test, I was like, well, I'll not have it. I did. Had treatment then, I cleared it. And my life's been a cycle of like addiction, trying to get clean, addiction, trying to get clean. So I relapsed again, and I picked it back up. And yeah, I've been on and off meds, started meds, came off meds. And then last year, something horrific happened to us. I ended up in the hospital, had a nervous breakdown, and still using. The nurse family Freeman managed to get a hold of us in the hospital. Started me meds again, left the hospital, still had it. And then something happened to us, something changed in us, and I knew I needed to get clean. And the Hep C was a part of that as well. Like there was, yeah, like something like for the first time, like I thought, like I started caring. Anyways, I got into rehab, and I started my treatment. And I cleared it. And then when I went for me, am I doing all right?
I do, absolutely. I'm breathing for you. I'm trying to.
And then when I came, so the day after I finished rehab, I got me final result that it was cleared from the Freeman nurse. Who the nurses at the Freeman, they were just absolutely great. You know, she really hunted us down, and she spoke to me family. Like, I'm really grateful for Emma. Caroline, she's called. Yeah, and then she put me name. So it was the day after I came out of treatment, and she'd given me name to Sue and Elaine. And we always say, don't we, it was from God. So basically, I'd applied for loads of peer mentoring courses. I've only just heard back from one of them last week. This is like 4 months on. And Sue rang us out the blue, and she was like, we'll have a course. But it's in 5 days, I think it was, in Middlesbrough. Do you want to come? And I was like, I was so nervous. And I remember I was sat in the kitchen with my mum, and I was like, this is a sign. So I went, and I've never looked back from that day. Yeah, so I went on the course because of what happened to us as well. I couldn't even hardly hold a conversation. Like, I was a bundle of nerves, and being with the trust, I never, like this time last year, like I was homeless on the streets of Newcastle, and being with the Hep C Trust, it's helping me help others who've been in my situation. Giving back to the NHS, because I hold a lot of shame of me chaotic drug use, and that, you know, they were giving us, like, I think I've had the meds 5 times. But you know what, that happens, and when I go out, like, I want others to know that there's no stigma around it. Like, never in my life did I think I would be sat in a room sharing that I had Hep C and letting people know that it's okay. But like, it is, it's easily treated, because for me as well, it was the shame of the hospital, the shame of telling other users. So we're all like, them probably had it as well. Do you know what I mean? We're all like using together and keeping it to ourselves. And yeah, so what else was I gonna say? Like, oh yeah, sorry. All right. So yeah, I've done, since starting with the trust, I've done so much training. Like, I've got it coming out with years, but I absolutely, I absolutely love it. I'm building my self-worth as a person. I always say as well, like, so before I got into treatment and in recovery and stuff, I had one worker, and when I was in active addiction, and that one worker believed in me, and if I can just help another person, and that's what I want to do. And yeah, and I just want to say as well, like, so on my last relapse, something horrific happened. It was like I was nearly killed, and that's why I was so broken as a person. And being with the Hep C Trust, like, that's been really hard for me. But the trust, it's give us purpose. So when things have got hard, like, it's give us something to hold on to. And I've just had a phone call before I come on here, the sentencing for what he did was today, and he's just got 13.5 years. So I'm a bit overwhelmed. But yeah, I can't thank the trust enough. They've saved my life. And I just want to help. Change a person. I know we can't save the world, can we? But if I can just change one person's life, that would be enough for me. And just to let everyone know, like, yeah, get a test. And I think I don't know what I've just said. Sorry. I've got me straight.
Thank you so much. Thank you so much. And I guess for anybody who's online, you would hear that, you know, and I think that's what this is all about today. It's about how difficult it is, the stigma we face, how difficult it is to get back and to be able to stand up and say all of this. And it's brave. You need to be brave, you know, to face the stigma, to challenge the stigma, to challenge the perpetrators. You need to be brave, and you are very brave. Yeah. It now gives me great pleasure to hand over to Prince. Are you still there, Prince?
Sure, yeah, I'm still here.
It's, okay. Did that make sense to you? Could you hear okay?
Yes, of course.
Yes, we would love to hear from you, Prince. Tell us a bit about your experience and how this lived experience is shaping across the elimination of hepatitis in Nigeria.
So thank you very much, Rachel. And then let me first start by commending Rachel for sharing her story. Really, very touching.
Oh.
And Dee too. You know, each time I listen to one more person sharing their story, I feel very encouraged as a person living with viral hepatitis B. You know, my journey started sometime in 2017. Yeah, I finished my university program as training as a pharmacist, and so what we do here in Nigeria normally after your graduation, 1 year will be put into service to serve the country, and so I was very excited and full of hope what the future will hold for me as a young pharmacist who just left school. Okay, and so after my internship and then my youth service, I happened to be the vice president of my medical and health services community development team, and so we had to, at that time we needed to do an activity, and so one of the activities was a blood donation drive, which was informed by some activity, some occurrence that happened where somebody lost his life as a result of no unavailability of blood in the blood bank as at that time. And so that informed us to organize the blood donation drive. And as one of the organizers of the blood donation drive, I was also, it made sense for me to also donate blood. And so when it got to my turn, the lab scientist bled me and then I analyzed the blood sample. And while I was just sitting out waiting for him to come bleed me, he just broke the news that, hey, Prince, I'm sorry you can't donate blood because you have hepatitis B. For a moment, I was blank. That never crossed my mind in any way. I never thought of viral hepatitis B or what was that really. Yes, while we were in school, we had some, thoughts about hepatitis, but not really in depth. So I really didn't know much about the hepatitis B. So I was really very confused when he told me I was not able to donate blood because of the hepatitis B virus. And I was not prepared for that kind of information. Like what we do in the HIV space where they do pre-counseling, there was nothing like that for me. So he just hits me with the news, bad news, I would say at that time, that, hey, Prince, you are positive and you can't donate blood. And he just zoomed off and went off to the next person. So I was very confused at that point. And I think up till now, I still cannot even tell how that program ended because I just left and went home, managed to get home and was very confused. So each day that passed, increased my confusion because I kept wondering, why would I not be able to donate blood? Why would I have hepatitis B and all that? So at some point, days passed, weeks passed, months passed. At some point along the line, I tried to really want to understand that what was this about really. But at some point there was this denial. I was just like, well, after all, I wasn't feeling sick in any way. So at some point there was this denial coming up, like ignore, nothing of really serious importance. And so I left. But sometimes also I would just get that that thought will come up again, like, oh, there's something there that you need to deal with. And so each time that thought came, I felt very depressed, you know. And at some points, it was affecting my mental health in a way. So I stopped really interacting, becoming social, really. I started keeping to myself at some point. And well, I now realize it took me up to a year to really be able to get out of this whole shock, because why mine was quite kind of complicated was because at that time I was preparing for my marriage with my fiancée then, and so it was very confusing. I didn't even know how to pass this information to her, to tell her this was the diagnosis, this was what I got. And so at some point I was contemplating on calling off the marriage plan, because I was not sure how this was going to impact her negatively. And so I had to summon the courage to talk to her that this is it, and I don't think this will continue. But I was very, very, it was like a U-turn when she replied and told me that it didn't matter. I think that was the beginning of a regret for me. Because if I, as the patient, the one who is living with viral hepatitis, was condemning myself at that time, and somebody who is not living with hepatitis wasn't saying that, and then that really jacked me up. And then I realized that I realized the harm I was doing to myself. And so, you know, she's been very supportive, my wife. We're happily married today, you know. She's been very supportive since that diagnosis. And so we were able to proceed with the marriage plans. We got married. And then in 2020, where I was working in the community pharmacy, somebody, you know, came to me and was talking about hepatitis. And it looked like at that time, it looked like people were coming to me where people were living with hepatitis. So I felt like this would be an opportunity for me to now start something to really educate people, because a lot of persons, I realized that knowledge was very poor. The information out there was really very scarce. And most times, at that time, the only information one could easily get was the negative part of the viral hepatitis. There was nothing to encourage anyone. And so I saw that huge gap. Even amongst us in the health space, I realized that the knowledge was quite poor. So I decided to start investing in knowledge, trying to surf the internet to see how much information I could gather. And that was how I was able to get in contact with the Hepatitis B Foundation in the US. And since my contact with them up till now, it has been tremendous. If I was told I would come up and be speaking in public fora like this, maybe if I was told sometime in 2017, I would not have believed. But with the support from the Hepatitis B Foundation, the knowledge, investments in people who are living with viral hepatitis, you know, that really helped me to now begin to shape my activities. And as a pharmacist, I decided to repurposed my practice to focus on viral hepatitis. Okay, and so what we now do now in my foundation, at that time, that was when in 2020, when I set up the foundation with my wife, I spoke with a couple of friends, colleague pharmacists, and also medical doctors. Okay, and so they shared my sentiment, and then they pledged to support me. I must say at this point that I've been blessed with huge support, and that's one thing we try to also preach, that people who are living with viral hepatitis B or C should come out, speak up, and then identify with the community. That way you would really, gain a lot of confidence, dispel a lot of myths surrounding this viral infection. And so with the support base I got, I was able to announce that we started the foundation and started, and initially it was, only within where I work. But at some point, I realized that we needed to really expand and go all out to, reaching out to people. And then the government advocating for better care for people who are living with viral hepatitis. And in 2021, the Hep Foundation, admitted me into the Global Community Advisory Board. And then since then, it's been wonderful. And with their support, our advocacy campaigns have now reached my governor, the governor's wife, because last year, November, where I invited Catherine to my state on an advocacy visit to the wife of my governor. And we were able to have this conversation with her. And she was surprised that this kind of viral infection that is of public health concern, is not given the needed attention. And so she promised us that she was going to discuss with the governor and see how things can begin to unfold. And we were surprised. The following day, the governor directed that all pregnant women be screened of hepatitis B and C free of charge. That the cost will be covered under the health insurance. And that was the first time that will be happening. And my state now, Delta State, happens to now be the very first state to have such a policy to screen by pregnant women, or viral hepatitis B and C free of charge. And I think for us, that was a remarkable achievement. And so that's further gave us impetus to start doing more. We're not relenting. We'll continue to push, because where we are going now, we are looking at it now from this perspective. Yes, when you screen pregnant women, and definitely you will find positive ones. So what do you do with them? You ask them to go home, because at the moment, access to diagnostics, viral load is difficult. Access to medication is difficult. And so that's another challenge that we are actually pushing for, to the government to see how they can, bridge that gap. Because it's not enough for us to screen and then we identify people who are positive and they cannot access medication, which is a problem. And so I'm grateful to the Hepatitis B Foundation for that, because we are implementing an access program where we are getting this medication at global access price and giving it out. So we are procuring them on behalf of the patient community and giving back to the people at the same cost it's coming. And for us, we are very grateful for that. And one other aspect is, when I discovered I was positive, I think in 2020, when I really started to set out to doing this advocacy work, I decided to screen my entire household, my mom, my dad, and my siblings. And that was when I realized that all my sisters, except the last born, positive for hepatitis B. My mom positive for hepatitis B. Some of my cousins positive for hepatitis B. So it was a clear indication that this was really mother-to-child transmission. And so, of course, even if my mom knew at that time, there was little or nothing she could have done because vaccines weren't available at that time. So that's why we're calling on the community really needs to really take the lead. That's what I try to preach to people. That message must be very clear that we can't continue to be laid back, to fold our arms and watch people advocate for us. We wear we wear the shoe, we know where it pinches. And so we can rightly advocate for what is right and what we really need. We must begin to be part of conversations around viral hepatitis. And I think the people who are living with viral hepatitis, are the best position to really call for best of care. Thank you very much, Rachel, for this opportunity to share my story. And I also want to thank the rest of the members who are live, who are in the room. Thank you very much. It's my pleasure to be here. Thank you very much.
Thank you.
Thank you, Prince. And I think that, I hope it's very different for us here in this room in the UK because there is access to medicines, there's access to diagnostics, and we have, and patients absolutely advocate for, but we work in a different system. I know, for both, for you in Africa, there are many people with lived experience who advocate across Africa. I know in Nigeria as well, you're a member of the Hepatitis Advocacy Foundation, and everything that happens on the ground is led by people with lived experience. And I guess, in China for UD, there's a huge, the government controls, from what I understand at the minute, there is access to medicines and treatment for all. But it is truly patients that sit behind. And I saw on the screen, just to see some of the other people arriving in the room with us, many from Africa, Kyrgyzstan, there's a real selection, but they are people with lived experience who are lobbying and pushing for action within their countries. We have just 15 minutes. I think it's really important that we had the opportunity to have, a really clear, broad overview from both of you, Prince, Dee, and of course, Rachel. How incredible. But we have 15 minutes for any questions, if anybody's got any questions. So that's online, and Ben, you'll have to give me a shout, or if anyone's got a question in the room.
We have a couple questions on this side, Rachel, but if you want to go to the room first, you can do.
Yeah, I think everyone looks in shock and stunned. Is there anyone that has a question, or shall we go straight to the room? I think it looks like for the minute. We'll go to the room first, Ben.
Okay, all right. So we've got a couple of questions here. So the first is from Fasil Kasahan. Fasil, sorry, I don't know which NGO you're from, but they say we're a local NGO in East Africa, Ethiopia, originated in a far region, and in Ethiopia, prevalence rate of viral hepatitis is around 28%. What can you suggest to help with the effort to fight it?
Wow. Prince, do you want to take that? No, Dee, don't shake your head. I mean, that's just shocking. I mean, like 28% prevalence. I mean, geez. Prince, Dee, or Rachel, is there anything that you kind of want to answer on that? Dee? Yeah? No?
Prince, after you.
Sorry, I'm not sure. Dee, did you want to go there?
Yeah, let me go first. So every time when I heard the percentage of the hepatitis B prevalence in Africa, some small area is around like 45, some other area is like 35. Now we have Ethiopia for some regions is around 28%. every time when I heard this staggering number in such a high level, makes me feel that how come in WHO statistics it's only like 10, 11, 15%? That really means if we wanted to, so the question is, because just helping what we can do to help with the situation is, first of all, we have to encourage any policymakers and the also WHO and the other people who have the power to really confront with the fact that Africa will be crumbled. Africa will be destroyed by hepatitis if we keep the number as a fairy tale level of 11, 12%. We need to do the screening as soon as possible. Otherwise, there will be more and more people dying on a daily basis. And these people are die from the hepatitis B, would not be diagnosed with the hepatitis B because they are not listed as the those 28%, 35%. They are outside of this 11% according to statistics of WHO.
Yeah.
Okay, thank you.
Prince, is there anything you want to say quickly around that? In terms of Ethiopia, taking your experience from Nigeria, and anything you can advise, or, aside from that kind of, your government signed up to a commitment, and where is their commitment now?
So I think this is one of the challenges we're facing in Africa, because when the people in government, policymakers, sometimes when they read these figures, they don't really see people behind the figure. They must be the faces behind the statistics, and that's why I always bring it back to the patient community. See, nothing would work without the patient community. I've seen it locally here. Before we started in Delta State, Nigeria, we didn't know what our prevalence was until I started. And then we started doing some kind of activities. And then that was when we were able to now really say, okay, have a picture, some kind of picture, that our prevalence in the States is 8% for hepatitis B and 5% for hepatitis C, with a population of 6.8 million. So that gave a clear picture. And then each time I have a conversation with those in the Ministry of Health, I always put forward my case as a patient. So when I talk to them as a patient, not someone who is advocating on behalf of somebody. And so that really resonates well with them. And our health systems are really very dysfunctional. That's one of the reasons why we're having high prevalences and all that. The birth dose, yes, even though Nigeria has been able to adopt the birth dose, but we found out, I did a study recently, I realized that birth dose is very poor, suboptimal. So it still boils down to the patient community coming out, speaking up, and then letting the government know that this is a real challenge, and there are people behind the statistics. You must invest in hepatitis. Thank you.
Thanks, Prince. And I guess maybe this, maybe what we should be asking is, what can we do to support? I mean, I know that, there's organizations, civil society organizations in Portugal who support pieces of work in Ghana, so what can we do? How can we support each other where, Egypt, for example, Egypt have gone and they're actually going to be doing some work to support another country now as well, one of the countries in Africa. So what can we do to support other countries across the world if we are in a better position? Lack of medication. Basil's just put a comment in there, and it's about a lack of medication. So, but we know that we have new Hep B guidelines. We know that medicines are available. We know that they're available at really cheap rates. So it's about, how can we ensure that happens? And I guess for anybody, who's on the call, and it's not just about Hep B, it's about Hep C too, and it's about, what's the availability of testing and treatment for Hep C too? Is there any other questions online, Ben? Because I'm just conscious we've only got 8 minutes left.
I'll just add one more, Ben, that we've had through from Oli Yamisi, who asked, what do you say, or how do you educate those who are tired of being on medication?
Ooh, how do you educate? So I'm presuming we talk about B. Any responses? I mean, if it's a B, if it's hepatitis B, you know, how do you, if you don't take the medication, you know, you're going to have liver cancer. So, you know, it's about the consequence, isn't it? I mean, last quick comments. Maybe I can ask each of you just to put a last, you know, reply, and then put your last comment in, because, and then that will take us to the end. So Dee, what about you first?
So my answer would be very simple. It's all about hope. I think all the Burmese or non-Burmese, you know, in a conference right now had a lot of saying about how frustrated when they're being treated on you know, weekly basis. So so if with that hope, we it's always like, you know, when the heavy patient doing the treatment, it's a long and dreary process, and many of us will just repeat the other, you know, the ALT level, you know, on and off from time to time. But one of the things that I think is some.
Sorry, Carmen, that's the English
translator
translator channel.
So it's all about hope. If we can, you know, construct and or maybe to what hope lies ahead for the treatment. So we will be, you know, less tired of the medication.
Yeah, thanks, Dee. And Prince, you know, how are you going to encourage somebody who doesn't want to be on medication, who's been on it for a really long time? How are you going to encourage them that they need to stay on it?
So yes, it's quite challenging, you know, being on medication. You know, I remember before the new WHO guidelines came up, two years ago, I decided to start taking medication, because at some point I realized that I needed to really have a control, some kind of control of this virus. Why wait, really? And so I've been on medications for the past 2 years now. So that's to my friend who asked that question. I know it's quite challenging, but see it from this other aspect. If you stopped taking your medication, the negative side, what is likely to happen? And thankfully, it's just one pill a day. Maybe hepatitis B, for instance, okay, one pill a day, and that's all, really, depending when we get to the final care. So I'm encouraging that person, see it that you are actually investing in your future, preventing liver cancer.
Yeah. Yeah, thank you, Prince. And then I'm just going to hand it over to Rachel to give her view in terms of, because it's not just about B, it's about C as well. So maybe, you know.
Yeah. So I would like, are you talking about me as a volunteer? So
Yeah.
maybe like just going out, people with lived experience who've been on the medication and have come out the other side, going out and speaking to them, and so they can visibly see that it's like, we can't keep taking it, and then we'll come out the other side. But also, like, people still using, you know, people probably want to take the meds, but I'm speaking from my experience, I was just too chaotic. So I think at the same time, making them aware, like the video we've just saw of Neil. I never met Neil, I wasn't at the trust then, but I even sent that to my brother and a couple of people. So because it is serious, just sharing stories, and hopefully we can make the change.
Yeah, and I think that's what this is all about, isn't it? I mean, that's what we were saying earlier about, you know, it's more, we are more than voices, we are action, you know, and it's about us, you know, you said it, Prince, you said it, Dee, you know, it's about us going out there, sharing our experiences and saying, you know, not just education, it's offering identification. You know, that's the whole thing about someone with lived experience, because you can share your lived experience, you immediately identify, you immediately can build trust, and then you can hear what someone's saying to you. Yes.
Sorry,
So Rachel's just going to say a little bit more.
yeah, and just like, so when we go out as well, we have it's spot the risks
Yes.
for people who are still using spot the risks in the needle exchange, and everything must be clean.
Yes, always. I mean, and we're talking about Hep C there, and not in Hep B in the same way, but for Hep C, when we're talking about harm minimisation, and that's about education and education around prevention, which I think is really, really important. Thank you. We need to know that we do need to do it, because it's not just about viral hepatitis. It's about maintenance. If we get to elimination, it's about prevention too. So we've got about 1 minute left each. Prince, Dee, Rachel, one last word in terms of World Hepatitis Day. What are you doing on World Hepatitis Day? How are you going to be acknowledging it this year? Prince, let's go to you first.
So we've got a line of activities here in Delta State. We'll be having some media engagements. We'll also be doing some screenings, collaborating with the Ministry of Health and WHO at the state level to sensitize people. And also we'll be making a public statement to the government, calling them, drawing their attention to specific aspects we want investment in viral hepatitis cascade of care. Thank you very much.
Thank you. And thank you for being here today, Prince. Dee, what about you? What are you doing for World Hepatitis Day?
We would like to do, such a very, a big gathering like what you're doing now in Birmingham. But it's unlikely to be happening, really soon in China, because having so many people gathering in the same place, it's very, very out of line of the restriction. So we talked to the local media, and so this year we mainly focus on communicating with the physicians, medical staff, and the media, and telling them that hepatitis is still on the line of sabotaging people's life. It's not, just don't stop downplaying hepatitis. That's the message we need to send to the people who have the the channel to bring out the information, the messages as well.
Brilliant. And Dee, thank you so much for being here today. Rachel, I mean, I guess this is what we're doing for World Hepatitis Day. Are you doing anything else as well?
I actually thought it was World Hepatitis Day today, because that's why we were doing this. Sorry.
So,
but from here, I mean, I've took half of the merchandise from the back. So, I will be,
so we've got loads.
I will be going around giving that about, and this day's made to say, I'll be sharing my story now with a lot more people. Yeah.
Fantastic. So Rachel and her, I mean, we've got people here from all across the UK. So we've got T-shirts, we've got merch, we've got booklets. We are lighting up buildings purple to celebrate, because in the UK we use purple as a colour to remind people it's World Hepatitis Day. There's actually buildings in Birmingham this week. We have people going out on walks. We have testing events like you, Prince. There's testing events as well, and you, Dee. And then we get our government to join in. So I guess I just want to say for everybody online, thank you for attending. Thank you to the speakers, Rachel, Prince and Dee. And I wish you all a very happy World Hepatitis Day. And please don't forget, it's time for action. We're running out of time and we really need to be doing more action. So have a great day and we will see you soon. Thank you. Bye-bye.
Bye.